From today, we will start a new chapter, and that is occupational health. A small chapter. We expect questions 5 to 7 marks or 8 marks in our university examination. One short answer question or a note, what we call it, you used to call it earlier, and 2 to 3, 1, 2 or 3 MCQs. So we will start. The park has taken about, our textbook has taken about 2 to 3 pages of describing about occupational environment, occupational hazard, occupational agent, occupational disease. There is no reason why they should be separated. They should be studied together. So that is what I have told you about my generalization principle. So environment, and we will follow the textbook. We will not deviate from the textbook, but we will make it much easier or some easier. Environments are 3. One is physical, chemical and biological environment. The second is man to machine, or we should say machine to man or man to machine, whatever it is. And third is man to man. So environment are 3. Then comes the occupational hazards. So hazards are also the same. He has now described into P, C, B, mechanical and psychosocial. Now I will just explain. These are same thing. Physical is physical, chemical is chemical, biological is biological, no issue. Man to machine has been converted into mechanical. Whenever we talk of man to machine, at our level, undergraduate level, we must understand that we are talking of a machine which is generating kinetic energy, which is movement is there. Like a lathe machine moves, it rotates, and there are various systems which move up and down the factory, industry. They are on the ceiling, so they are moving, carrying the weight, or there are trolleys moving on the ground. So there are various things moving. A car is moving. If I am a driver by occupation, then I am driving a car, and car is generating kinetic energy. So man and machine is basically mechanical, and mechanical means conversion of kinetic energy into some injuries and accidents. That is good enough. Man to man is psychosocial. So man to man we will cause psychosocial problem. We will cause anger and anxiety and depression and stress. So this is same. Then we come to the agents. Now physical agents you can easily think of. Our chapter on environment health is nothing but physical agents. So we can heat and cold and vibrations and pressure and UV rays and IR rays and noise, and then comes humidity. We will add heat only, or there may be 1 or 2 more. So remember, in physical environment we are talking of heat, we are talking of cold, we are talking of vibration, we are talking of pressure, noise, ionization radiation, UV radiations, there may be light, there can be light. So these are our physical environment in an industry. Think of industries, it can be in any occupation. Now I will finish it here only. Now I will proceed it here so that we are on the same thing. Now diseases which are caused by heat, that we know. It causes heat cramps in us, it causes prickly heat in me, it causes heat exhaustion, it causes heat syncope, or what we also call heat stroke. So 4 diseases we are well aware of. So these becomes our disease. Cold diseases we know. It causes chilblains, it causes hypothermia, generalized exposure, which causes death. It causes frostbite, and it causes trench foot. Now difference between frostbite and trench foot you should appreciate for your NEET PG. Frostbite is dry plus cold. It is a dry cold, while trench foot is wet, cold. Vibrations. Vibration causes a disease which is described in Park, our textbook, as white fingers. Another name for this which can be is Raynaud phenomena or Raynaud disease. So vibrations, remember, just remember, it is related with white fingers, Raynaud disease, Raynaud phenomena. Pressure is related with Casson's disease. Casson's disease occurs when in the deep sea divers, when they go down, the air gets absorbed into their system. When they ascend fast, when they ascend and their ascent is fast, then this air which has gone into their system, their blood, it comes out. Because now the atmospheric pressure is less. It comes out as bubbles and it creates symptoms. When it comes out, it is joints and in my abdominal viscera and cavities, it causes what is known as pain, which is called bends. Bends means nothing, I bend with my pain. And it comes in my chest, respiratory system, it causes respiratory distress, which is called as a phrase, chokes. And it is in the nervous system, in spinal cord, it causes neurological deficit, which has been called stagger. So the phrase used with Casson's disease is bend, chokes and stagger. UV rays will cause, we know, rodent ulcer. It can cause some cataract. IR radiations, radiations are related with, ionization radiations are related with cancers, blood cancers, leukemia, other cancers, aplastic anemia. Mainly you remember it is related with blood disorders. Noise, we know, noise induced hearing loss, which we must be learning in ENT. Light, we remember, there can be a Meniere's nystagmus, is a specific disease which is because of less light in the minds, light problems in the minds. So these are my physical agents and these are my diseases. I am not going into, I am going slightly fast because these things are available in my notes, which are available on Amazon now. So when you will go to Amazon, you look for community medicine, Varun's note on community medicine, for MBBS student community medicine. You will find red chart, this thing, and you can purchase, not costly, I have kept the cost minimum. Now we come to chemical. Chemical, we have to remember three things. That is the absorption of chemicals. Chemicals can get into my body through skin. The best example is organophosphorus compounds. It can get into me through inhalation. The good example is we get carbon monoxide poisoning because of inhalation of carbon monoxide, and also lead. Till now, because we were using, till few years back, we were using leaded petrol. So it was inhalation of lead which was causing the toxicity. And third, it can enter into my body through ingestion. So three routes are there that we have to understand, and we must remember at least one example. Biological agents is no problem. You can write down any disease. Tuberculosis is a biological problem. COVID was a biological problem for healthcare workers. Tetanus for agriculture workers. Similarly, this lab, people who are working in the lab are exposed to large type of infections like brucellosis and anthrax. And these are occupational hazard. You write down 7-8 diseases depending upon the time available. Mechanical, we have discussed, is injuries. And psychosocial, which is related with man to man, are psychiatric problem or psychological problems like insomnia, anxiety, depression, stress, headaches, and also psychosomatic diseases. Psychosomatic diseases are diseases like peptic ulcer, like IHD, hypertension. These are also called psychosomatic disease, in which the psyche also plays a role along with the normal etiological agent. So I am stopping here. So these are our agents. Now we will most often use epidemiological triad in our occupational disease disorders. So when I will discuss pneumoconiosis, I will discuss the agent factors, which will be some of these, and host factors and environmental factors. So I am stopping here. Next time we will study prevention and control of occupational disorders. And once we have done that, then we will go to specific disorders, because with this basic understanding of disease causation and prevention and control principles, we will be well set to study specific disorders. So we will go this way, and not from disorders we will go to prevention, which you will find it easier. Thank you.